Hello, everybody. I thought I should record a video on how to look at your high-low blood pressure device data. I'm Dr. Shabnam Das Kar. I'm a functional medicine doctor with a special interest in blood pressure, better blood pressure management. This is a report that most of you have seen. Hilo was earlier called Actia, now it's called Hilo. So I have shown you this, I'm showing you this report. And as you can see, I have deleted the person's name and age and all those details just to maintain the privacy. So this is the report that you export from your Hilo device when it says you can generate a report and you have the option of either view or share. And you can, what I suggest most of you do, you've done it, is if you want to share it, share one with my clinic, to my clinic email ID, and also you can share, email it to yourself. So this is what a report looks like. And so first thing, what are the things I would look at in a report? First of all, this is the summary table that you can see at the top of your report. One of the first things to see is the number of readings. So this is showing all measurements is about 200. And this person has taken the recordings from 1st of September to the 15th. But from this, you can see that in between from 3rd to the 8th, there was no data. So the person had taken off the device or it didn't record. Very likely they had taken off the device. So though actually the time covered is 15 days, the actual data is not 15 days, it's about 9 days. So that is important to know because there is missing data for about 7 continuous days in between. So why is that important? Now, 200 readings over a period of 2 weeks or 15 days is an average of about 13 readings a day. Some days there were more readings, some days there were less readings. Usually, a Hilo device measures about 25 readings in a day, and no reading is taken when our hands move. So it only takes a reading when the hand is steady. And the other thing is, usually in the ideal world, there should be no more than 2 hours gap in between two readings. And again, based on Hilo's research, they found that at least 6 readings a day for continuous 7 days at a stretch would be ideal for measuring time in target range and things like that. And I'll talk about time in target range. So first of all, what do you see here? Mean systolic blood pressure, mean diastolic blood pressure. And this is daytime, this is nighttime. So this person has lower nighttime blood pressure than daytime, which is very good. And I will talk about nighttime blood pressure separately. Then next is what are the maximums and the minimums in all the readings. And then, of course, the total number of readings. At this point in time, I would suggest don't give a lot of importance to the standard deviation, SD, because so standard deviation is basically how much of variation is there between from the mean of systolic and diastolic. So this is a number which is going to become important as we have more research and data. There's something called blood pressure variability. So right now, I would say just ignore it for now because blood pressure variability, meaning if your blood pressure goes too high or too low, both of those are not very good. But what is the accurate number? What is correct? What is important? Because men and women have different blood pressure variability and heart rate variability. So at this point in time, we don't have enough information, but this is something that will be important as time goes. The other thing to remember is the Hilo device is fairly new. And we know that for blood pressure numbers to show any effect, sometimes it has to be, it has to be years before it can show, what it actually means. And the Hilo device has not been around for that many years. And however, it's important to remember that it is clinically validated. So back in the days before the Hilo device, you know how we measured blood pressure at home. We used that upper arm cuff device, which wasn't always accurate because of the ways it is measured. If arm is not supported, back is not supported, legs are dangling, not supported. We have had caffeine recently with the full bladder. So all those things can contribute to inaccuracy. So compared to that, what the Hilo device does is what I absolutely loved it for, is it measures blood pressure in the background without having to, without having me to take manual action. So going back to the data, so one is these many days data is missing here. And another thing is you can read this. One more thing I wanted to remind you is many of those devices, they are still set to the European Society of Hypertension guidelines. So hence you can see that it is 130 by 80. 130 by 80 is not bad. But as some of you know, that if what your target blood pressure should be is something that is very personalized. So as you know, if you are younger and you don't have a whole lot of other disease conditions, I insist on a stricter control, because we know that over a longer period of time, the longer time you have spent at a higher blood pressure level, the worse is the outcome. And if you are someone in your 30s or 40s or 20s, you have many, many, many years of life left. So that is the reason I'm stricter with people who don't have a whole lot of other diseases. You need to talk to your doctor about what your target levels should be if you have kidney disease, if you have heart disease, if you are on multiple medications, if you have diabetes. And this is not medical advice, but many of you who are going to watch this video, I have talked to you about the stricter numbers that you need because of your younger age, or because you do not have a whole lot of diseases going on. So that is the target blood pressure is important to know what should be your specific target. And as you know, I talk about not just lowering blood pressure with only medications. I also talk about lifestyle changes, changing your salt, adding supplements, moving more. All those things I have covered in other videos. But here I'm going to stick to the Hilo report. Next is, you can see the report here. So you know what this icon indicates. It's the legend is given at the bottom. It indicates a calibration with the cuff. And this would be a cuff measurement. And the on-demand phone measurement is not available yet for the devices in Canada. Once they are available, we'll see what it shows. It would probably be something with the camera. I'm not very sure. So, one point I want to highlight here is, though the app recommends that we should calibrate once in 30 days, if you calibrate more often, and that is what the app suggests as well, the accuracy is improved. So, one point to remember is, if you feel that your readings don't seem to be correct, or they don't match what is shown at the doctor's office, and as you know, the doctor's office readings are not the readings we need to take we need to make decisions about treatment based on the single reading at the doctor's office, which is often not very accurately recorded, versus what guidelines call out of office blood pressure measurement. That means out of the doctor's office. So your home blood pressure measurements, now the Hilo device measurements, or the 24-hour ambulatory blood pressure device measurements. But if you're using a Hilo, you will not need the 24-hour ambulatory, which is also quite cumbersome. So if you feel that no, my numbers don't seem very accurate, these are wrong, they're too low, they're too high, whatever, what I would suggest is take the blood pressure, use the high-low cuff measurement, and recalibrate more often. So that would be one tip. Next, what I'm going to do is, I am going to, because I need to analyze this data. Yes, in the ideal, I'm sure in the future we're going to have something like that, where we put in the data into an app or a web or a browser based tool, and it's going to come out with all the analysis for us. At this point in time, I don't have access to anything like that, and I will not create one like that without without having the security and the privacy measures in place. I know many of you will think that, oh, we can do a vibe coding and code something that is going to analyze all our data. The fact is, some of those vibe coded apps, if they don't have the security features in place, we've heard about data being stolen and hacked from those some of those apps. So just a warning. And I don't have the technical expertise to create that analysis tool now. So I'm going to share what I do with the data and how I use Gemini, which is again an LLM tool like ChatGPT. So what I'll show now is I'm going to copy this blood pressure data from here. And in the interest of time, I'm not going to copy and paste all of them. So once I copy this, I will stop sharing this screen and start sharing another screen. So I'm going to paste it onto a Google sheet. I already have a blank sheet created. Oh, I've done this. Sorry about that. So this is a blank Google sheet. Now my Google Workspace account is actually, I have signed something called the BAA. So it is supposed to be HIPAA compliant, but I want to be very careful about data privacy. So mm, whether you should use it, use your own Gemini account, Google account, or ChatGPT, that is your decision. I don't want to be involved in that because of privacy concerns. So what I did is from that PDF, I have copied it and I'm going to paste it here. Now, when you paste, you can see that what you need to do is split text to columns, and instead of detecting automatically, you select the space. So that is how it's supposed to differentiate, separate it. Now you can see the first one is the columns are not labeled correctly, and I'm going to delete the first two columns because one is a 14th August. So delete rows, sorry, not columns, rows. And then what I will do just to help Gemini, I'm going to add an extra row and label. So insert a row above. This is day, this is month. Yes, I wish it would, label it correctly and put the entire date into one column, but it doesn't. And I have tried asking Gemini to label the columns, and once it told me that it is outside its capacity, and I wasn't very sure why it should be. So I didn't want to take the risk, so I manually labeled the columns. So here I have not pasted all the data, but again, I'm going to delete these two columns. Though I am not sure whether leaving them is going, sorry, delete the two rows and not columns. So as you can see, there were 200 readings, and out of the 200 readings, I have only pasted 51 here. In the interest of time, I'm not going to paste all of them. Next, what I will do is here is the Gemini that comes with my Google Workspace account. And you can ask Gemini other questions as well. Now, I tried to create something called a gem, but this gem did not work very accurately, so I'm going to ignore that. And right now, I don't think I can even share it with all of you. So, and I tried to delete it. Somehow I could figure out a way to delete it. What I will do is I created a prompt for Gemini because there are certain things I want to see in the blood pressure data beyond what Hilo report shows. So I will share that prompt with you, and I'm sure all of you can improve the prompt a lot more than what I have done. And if I can improve the prompt some more as time goes, I will definitely share the improved prompt with you. But for now, so I'm going to ignore this. Just gems are like basically smaller tools that you have created for things that you repeatedly do. I am going to share the prompt that I created, and I have it on a Google Sheet. So I'm going to copy and paste that, and I'm going to share that prompt with you. And like I said, I'm sure you can improve the prompt a lot more because I'm still learning prompting. So basically what I'll do here is I'm going to select this and I'm going to copy this. And next what I will do is I will go back to the Google Sheet and go to Gemini. I'll share that with you 1 minute. So I am back on that Google Sheet where I had pasted all the blood pressure data from the Hilo PDF report. And here where it says enter a prompt here, I'm going to paste the prompt that I have already created. And then I'm going to wait for, oh, for some odd reason, this is showing my gem. I don't know how to figure that out. Let's see what the analysis shows. When I tried this a few times it got it right, a few times it told me the calculations were too difficult for it. So total number of readings is 50, which is correct. So this is again something you need to remember. When you're copy pasting manually from the PDF to a sheet, sometimes it is very, because it's manual, it's very easy to miss out. Maybe you missed out one page or you missed out one column. So make sure that the two tally, because the Hilo report will tell you how many readings there were. And if you haven't pasted that many readings, then it means you have missed out a few. So it shows the date range. And so what did I include mm, in the prompt? Here you can see what are the different things it has. So this was a, like I said, a copy pasted prompt. So I don't need to prompt a new prompt every time. And what are the different parameters I'm looking at? So what I'll do is for 1 minute, I will, so this is the calculation that Gemini has done. And I do hope you can see it well. This says collapse. No, I want to make sure all of you can read this clearly. So this is okay, the date range, number of readings, percentage of systolic blood pressure between 90 and 120. That was 98% of the readings of these 50 readings. You will be doing it with all your entire readings, and some of you have like 400, 500 readings in each report in each month because you're diligent with with your measurements. Next is percentage of diastolic blood pressure in the 70 to 80 range. Now, you don't want blood pressure to be too low or too high. Now, this is something that we call time in target range. And again, time in target range for men and women will eventually be different. Right now, for men, if we are looking at a time in target range of 120 by 80, this person has 98% of the readings. But the moment we reduce it to 110 by 70, the time in target range has become lower. It is 66% of the time this person's blood pressure is in this lower range. You've heard me talk before that women probably need a lower blood pressure threshold, but none of what I'm saying is actually medical advice for each one of you. If you are my patient, then you know I talk to you individually. And if you're not my patient, then you need to remember that you have to talk to your doctor about what your target blood pressure should be. Now, time in target range is something that we are going to see more and more data about it. So in the Hilo device, they had done one trial which included more than 80% were men and didn't include enough women in that trial, where they looked at 5,000 of their users who shared that, who provided the data. And based on that, they looked at time in target range as 1 week with at least 6 readings a day and 7 consecutive days. However, if this particular report, as you remember, there was a discontinuity in between, there was no data for 7 days. So instead of this is again, this has not gone through very strict clinical trials yet. We'll have more trials later. What should be the time in target range for you? Do you need to be as strict as 98% in 120 by 80? This is again, it depends on many different factors. It depends on what your age is. It depends. So for a younger person, as you know, I usually have stricter range because you are going to live with hypertension for many, many years. So the number one goal for hypertension treatment is to prevent what we call end organ damage. So blood pressure numbers have to remain at a level which does not damage your heart, does not damage your kidneys, does not damage your brain, your eyes, or sexual health. So any of those organs can be affected by high blood pressure, and once those are affected, that is called end organ damage. So besides blood pressure numbers, the most important goal for blood pressure treatment is to prevent end organ damage. And that is the reason you find that I check for kidney function in addition to just serum creatinine and EGFR and urine microalbumin. I also check for cystatin C and all heart function. There are gazillions of tests for that. So the reason vision, I usually insist that you have at least once a year you should have an eye checkup, and more frequently if your eye doctor thinks you need it more often. Sexual dysfunction, usually it's a history. Do you have any of the, because the important thing is your blood vessels, the health of the blood vessels is extremely important. So one is blood pressure numbers, the next is prevention of end organ damage. And here again, whether it should it be 98, should it be less, can you do with a little less stricter control with blood pressure? We don't know yet. As the years go, we will have more data, because right now the Hilo device hasn't been around for very long. So we need data over many years for more number of people, and people of, who look like you and who have your kind of health parameters. Or should women go for a stricter range of blood pressure data, blood pressure range? That is also something that this is not set in stone right now, but this is an important number to keep track of. Obviously, if your blood pressure is in the target range of 120 by 80, 98% of the time versus 50% of the time, 98% would be better. But is it at the cost of adding three medications and doing a whole lot of other things and having side effects from medications? No, you know that I don't talk about only medications, but medications are extremely important for blood pressure management. Then the pulse pressure. So the pulse pressure is the difference between the average systolic and average diastolic blood pressure. And this is a number which tells us about this is sort of a surrogate number for arterial stiffness. You don't want your arteries, your blood vessels to be stiff. You want them to be flexible and soft. So pulse pressure between 40 and 60 is considered normal. This person is normal. Then mean daytime blood pressure, mean daytime systolic, diastolic, you can see that these are fine. Now, nocturnal dipping. So in normal blood pressure, nighttime blood pressure is supposed to be lower by 10% compared to daytime blood pressure. These calculations I had already added in the prompt. So the Gemini already did the calculation. So nocturnal dipping percentage is 4.6. So it is less than 10. So this person is a non-dipper. Now, one thing I want to highlight is uh, high-low devices nighttime blood pressure data is not like there is a little bit of a challenge with the accuracy, but daytime blood pressure recordings are fine, and when they have been compared with the standard of care. So, and nighttime dipper, non-dipper status, I will talk about this on another video, because one thing, if someone is a non-dipper, one thing I think of is what time are they having their medications? If they are having it at in the morning, sometimes many of you have switched your medication to night. And if you switch to night, sometimes the dipper status changes. For some people, it could be an indication of obstructive sleep apnea. Then this flags something when I would tell you that you need to be checked for sleep. You need to get a sleep study done. So sleep apnea is when someone stops breathing at night, and that can, having obstructive sleep apnea that is not corrected, can raise risk for heart disease, stroke, and dementia, and mood disorders as well. And women may not always have similar symptoms as men, like snoring and stopping breathing. Women may have things like early morning headache or fatigue, or sometimes it is anxiety. So unless you do a sleep study, you won't know whether you have sleep apnea. So another important factor of the dipper status is having insulin resistance. So being pre-diabetic, having belly fat, high triglycerides, fatty liver, Blood glucose levels that your doctor is saying that you need to watch them, they are higher than they should be. Having a history of pregnancy, diabetes, all these conditions are related to insulin resistance. Having insulin resistance also causes a non-dipper status. Then the next thing is early morning surge. Now, here, early morning surge is supposed to be actually related to the time you wake up. Now, you know that the Hilo device cannot detect what time you wake up. It usually has a question which asks, did you go to bed at whatever bedtime you have put? But all of us know that all of us don't sleep at the same time every day and every night. So, for to make it simplified, there are different, definitions of early morning surge. Early morning surge means rise in blood pressure, which is exaggerated. Blood pressure does rise in the morning, but if it is very exaggerated, some definitions say more than 25 millimeters of mercury, then that is something we need to look at. And some ethnicities like the Japanese people have more of early morning surge in blood pressure. We don't know enough about South Asians, people from India, Pakistan, Bangladesh, Sri Lanka. But this is something important to keep in mind after we have looked at getting the average blood pressure to target range. This is not something I talk about always, because one thing is, here we're just making an assumption of what is the morning surge, whereas actually we should be able to. So, in 24-hour ambulatory blood pressure tests, where they actually looked at early morning surge, they had patients manually reporting their bedtime and wake up time. But in the traditional ambulatory blood pressure test, that was only for 1 day or maybe maximum 7 days. And manually recording bedtime and wake up time for 7 days is easier than doing it for like 1 month. But if it is something that you find that this is way really abnormal, then I would suggest then actually manually note down your bedtime and wake up time, and then calculate the early morning surge. And then you need to talk to your doctor to discuss exactly whether your medication timing can be changed in any way for this, or do you need to look for other things. So this person does not have an exaggerated early morning surge, so this is fine. So based on this, you can see that there are so many other parameters we need to look at. And one thing I want to highlight is, if you find that one day suddenly a single reading, you have not exported your data to check the weekly or the monthly readings on your Hilo device, you woke up suddenly in the middle of the night and you suddenly saw your blood pressure was like 150 by 95 or something. Don't get alarmed with single high readings. And in fact, some of you have suggested that maybe for some time you need to put the device away, because if it is increasing your stress and anxiety, then that is not really helpful for you. And if your medication has been changed just 1 day before, we need to usually wait for 1 to 2 weeks before we can decide whether this medication is working or not working. Again, usual caveats, this is not medical advice. If your blood pressure is really extremely high, then definitely you need to get medical attention soon. But what I would suggest is, first of all, don't get alarmed by single high readings suddenly. One is recheck, and recheck with the arm cuff if necessary. And if it remains persistently high, then that is something. Don't go by, small variations over a few hours. Blood pressure is supposed to rise and fall. And that is the reason we talk about the time in target range. So, but the important fact is we still need to figure out whether, for long term health, a time in target range needs to be 90%, or it should be, or 80% is good enough. That we will know over a period of time when we have more information and more research studies. So, I have a separate video on nighttime blood pressure and what it indicates. And all the best. And if you have any questions, feel free to email me at info at the rate drkarmd.com. So info at drkarmd.com. And take care.